Hello everyone, I'm Dr. Prachi Kulkarni, Fertility Specialist, Ferty9 Fertility Center, Banjara Hills. Today we will talk about IVF. What is IVF, how it is done, and what are the indications for IVF. So IVF is also known as test tube baby. The full form of IVF is in vitro fertilization, which means fertilization which is done outside the body or in the lab. So what we do in IVF is we give injections for 10 to 12 days to stimulate the ovaries to develop multiple eggs. So this is the first stage of IVF, ovarian stimulation. Second stage of IVF is where we take out the eggs outside the body by a procedure called ovum pickup. This is done under anesthesia with a transvaginal ultrasound guided probe. A needle goes next to the probe and we aspirate the follicles. Once the eggs are out, the third step of IVF is making the embryos in the lab. What we do is each egg is combined with one sperm and we check for fertilization next day. The fertilized eggs are then observed in the laboratory in optimal condition to see how many embryos are developed. So usually we wait till day 5 or day 6 where we get a blastocyst stage embryo. Once we have a blastocyst stage embryo, we can select one embryo or two embryos and put back inside the uterine cavity, which is the last step of IVF, which is embryo transfer. So embryo transfer can be done in the same cycle when it is called as fresh embryo transfer. Sometimes we may freeze the embryos and we plan the embryo transfer in the next cycle when it is called as frozen embryo transfer. So this is IVF. Now we'll see what are the indications for IVF. So first indication for IVF is blocked fallopian tubes. If someone has both the fallopian tubes blocked, natural conception cannot occur in the body because egg and sperm cannot meet in the body because of the obstruction in the tubes. So this is the first indication for IVF. Second indication for IVF is where male sperm count is very low, like less than 5 million, where we have to select a sperm for ICSI. Third indication for IVF is where we are using testicular sperms to make the embryos. So these are the conditions where we use testicular sperm. Somebody who has very low, like cryptozoospermia, where the sperm counts are less than 1 million and we cannot find good sperms in the sample. Or somebody who has azoospermia, where there is zero sperms in the sample, we have to use testicular sperm. So if we are using testicular sperm, we have to use it for ICSI in IVF. So these three are the absolute indications for IVF. Other indications for IVF are like somebody who has undergone other ART procedures like trying naturally or IUIs multiple times and it has not helped them to achieve pregnancy, or somebody who has multiple factors causing infertility like male factor with very low sperm count along with the uterine factor where we have to suppress adenomyosis or endometriosis. Such patients also we can advise to go for IVF. Somebody who has very low egg reserve and we have to do any genetic testing on the embryos, also we advise to go for IVF. So these are the indications for IVF. Hope this was helpful. Thank you.